The College of Nurses of Ontario presents the Therapeutic Nurse-Client Relationship, Maintaining Boundaries webcast. At the core of nursing practice is the therapeutic nurse-client relationship. The nurse establishes and maintains this key relationship by using nursing knowledge and skills, as well as applying caring attitudes and behaviors. A therapeutic nurse-client relationship contributes to a client's health and well-being. This webcast is based on the College's Therapeutic Nurse-Client Relationship Revised 2006 practice document, which applies to all nurses in all roles and practice settings. Viewing this presentation is not considered a substitute for reading the practice standard. The Therapeutic Nurse-Client Relationship Practice Standard includes 4 standard statements that describe the nurse's accountabilities. They are using therapeutic communication, ensuring client-centered care, maintaining boundaries, and protecting the client from abuse. Each statement has accompanying indicators, which are broad statements that nurses can apply to their particular practice reality. This webcast will focus on the Maintaining Boundaries standard statement. The presentation will help you set and maintain boundaries, reflect and think critically about your nursing relationships with clients, and feel confident that the relationships are therapeutic and focused on the needs of your clients. There are 5 components to the nurse-client relationship: professional intimacy, power, empathy, respect, and trust. Regardless of the context, length of interaction, and whether a nurse is the primary or secondary care provider, these components are always present. Trust, the first component, is critical in the nurse-client relationship. For a variety of reasons, the client is in a vulnerable position. Clients often believe that healthcare professionals, including you, should not be questioned. They may not understand the healthcare system, and they may be simply overwhelmed with their healthcare needs. When clients are receiving nursing care, they are placing their trust in you. They believe that you have the knowledge, skill, and judgment to provide them with the best possible care, and that you will do what is in their best interest. If this trust is breached, then it will be difficult to reestablish. The second component, respect, is the recognition of the inherent dignity, worth, and uniqueness of every individual, regardless of the person's socioeconomic status, personal attributes, or health problem. Professional intimacy is inherent in the type of care and services that nurses provide. It may relate to the physical activities, such as bathing, that nurses perform for and with the client that create closeness. It can also involve psychological, spiritual, and social elements that are identified in the client's plan of care. Some examples of professional intimacy include asking questions about a client's mental health, knowing the circumstances of a client's home life, discussing a client's sexual activity, knowing a client's health status, and having a client share his fears or concerns prior to a procedure. Another component is empathy. This is the expression of understanding, validating, and resonating with the meaning that the healthcare experience holds for the client. In nursing, empathy also includes maintaining an appropriate emotional distance from the client to ensure objectivity and a professional response. The final component is power. The nurse-client relationship is one of unequal power. Although it may not be immediately apparent to you as the healthcare provider, you have more power than the client. You have more authority and influence in the healthcare system, specialized knowledge, access to privileged information, and the ability to advocate for the client and the client's significant other. The appropriate use of power enables you to partner with the client to meet the client's needs. A misuse of power is considered abuse. There is a process associated with the development, maintenance, and termination of the therapeutic nurse-client relationship. When you first meet a client, you introduce yourself by your full name and as an RN, RPN, or NP. You also explain your role and the client's role in the therapeutic relationship. In doing this, you set the boundaries for the relationship and explain what the client can expect and what you will be providing. This sets the stage for the care that the client needs. As the therapeutic relationship develops and you and the client get to know each other better, you should reflect on the relationship and clarify with the client the roles and expectations, especially in situations where the client may become unclear about the boundaries and limits of the relationship. Preparing the client when the therapeutic relationship is terminated is an important step. You can meet the client's needs by helping him or her transition from your care. It will also help you with closure of the nurse-client relationship. The standard statement for maintaining boundaries states, nurses are responsible for effectively establishing and maintaining the limits or boundaries in the therapeutic nurse-client relationship. A boundary crossing in the nurse-client relationship is the point at which the relationship changes from professional and therapeutic to unprofessional and personal. When a nurse crosses the boundary in a nurse-client relationship, the nature and dynamic of the relationship changes. The balance of power between the nurse and the client becomes more unequal, increasing the client's vulnerability. Crossing a boundary means the nurse is misusing the power in the relationship to meet her or his personal needs, rather than the needs of the client. The misuse of power does not have to be intentional to be considered a boundary crossing, and often nurses do not interpret their actions as a misuse of power. The following is a scenario about crossing a boundary. Pierre, a nurse, has been caring for a client, John, for the past 3 months. On his drive to work, Pierre has a frustrating incident occur on the highway. When he arrives to care for John, Pierre immediately starts complaining about the incident and explaining his frustration with the other driver. The following are some questions you can ask yourself about this scenario. Is this appropriate behavior for Pierre? How does this affect the care he is providing to John? Is Pierre providing client-focused care? How could Pierre's behavior affect John? Is there potential for Pierre to upset John? Is there potential that John could become the caregiver during this visit? How does this change the dynamic of the relationship? How will this affect the nurse-client relationship? Is Pierre's behavior professional? Is it ethical to be discussing personal issues that are not relevant to the client's plan of care? In this scenario, Pierre was focused on himself and his issues, rather than on providing client-centered care. His behavior was not professional and put John in an awkward position. If John were to give Pierre advice, John would become the caregiver. A more appropriate way for Pierre to handle future incidents is to deal with the issue in a private manner, in a way that does not involve his clients and does not affect the care he provides to his clients. Here are some general principles for establishing and maintaining boundaries. Self-reflection. To achieve an effective therapeutic relationship, you should continuously reflect on your interactions with the client. You also need to reflect on your own values, cultural biases, and attitudes, and understand how these can affect a relationship with a client. Plan of care. It is important that you develop a comprehensive plan of care with the client, his or her family, and other members of the healthcare team. The plan of care provides guidance and direction regarding the boundaries of the relationship and the approaches best suited to meet the client's needs. Confidentiality. Explain to the client the limits of confidentiality and the requirement to share the client's health information with the healthcare team. For more information, refer to the college's Confidentiality and Privacy Personal Health Information Practice Standard. Type of relationship. The therapeutic relationship differs from a social relationship or friendship in that the needs of the client always come first. As with all areas of nursing practice, to maintain boundaries, you should constantly reflect on your practice and the care you provide to a client, and remember that the needs of the client are always the focus of your care. Develop some questions to ask yourself after you see a client. For example, am I spending more time with this client beyond his or her therapeutic needs? Did I disclose personal information to this client? Am I behaving or dressing differently when I meet with this client? Do I do extra things for this client, like run errands, take pictures, or buy gifts? Do I accept gifts from a client? The college's Therapeutic Nurse-Client Relationship, revised 2006, practice standard lists warning signs that may indicate you are crossing a boundary. This list will help you reflect on your practice and make sure you stay within the boundaries of the therapeutic relationship. Certain practice settings may require you to maintain an increased awareness and attention to professionalism and boundaries. Examples of such settings include pediatrics, long-term care, rehabilitation, and care in the home, where clients might be more vulnerable. These practice settings can be challenging as you may develop long-term relationships with some clients and become more comfortable with the care. You could even get to know some personal aspects of the client's life, which can make it hard to maintain a professional relationship. The following scenario explores this issue. Sasha has been providing nursing care to Monique for over a year. Every time Sasha provides care, Monique offers her a juice to drink, which she accepts. While they are drinking it, Sasha asks Monique how the last few days have been, how she is feeling, if she is progressing in meeting her goals, and if she has any other needs. They also speak of the weather and current events. Sasha uses the time to observe Monique's behavior. Sasha has asked her healthcare team if they have concerns about her sharing a drink and discussing Monique's healthcare needs with her during the visits. The team agrees that they don't have any concerns, since the discussion is focused on Monique's healthcare needs and it allows Sasha to make an assessment of Monique. They believe it helps Sasha further develop the therapeutic nurse-client relationship with Monique. They do remind Sasha that the needs of the client are always the focus. The following are some questions you can ask yourself about the scenario. Is it appropriate for Sasha to have a drink with Monique? Are the drink and conversation client-focused care? Does this change the dynamic of the nurse-client relationship? Is Sasha spending extra time with Monique beyond her therapeutic needs? Is Sasha disclosing personal information to Monique? Is Sasha's behavior professional? In this scenario, Sasha has turned the sharing of a drink with Monique into an opportunity to discuss her health in a relaxed manner. Sasha feels that accepting the juice does not cross a boundary and ensures that the interaction remains therapeutic and never social. The following is a scenario about maintaining boundaries and confidentiality. Ella practices in a small town. She uses social media and is on Facebook to keep in touch with friends and family. Ella is assigned to care for Karen, a client who also works in a local cafe that Ella frequents. Karen notices that Ella is always texting her friends or is on Facebook when she is in the cafe. She decides to send Ella a friend request on Facebook. The following are some questions to ask yourself about the scenario. If Ella accepts Karen's request, would it cross the boundary? Would it change the dynamic of the nurse-client relationship? Would it be professional? Is it appropriate for a nurse to socialize with a client on social media sites? Does social media provide an avenue for personal information to be shared on both Ella's and Karen's profiles? Is Ella risking disclosing personal information? Nurses have ethical and legal responsibilities to maintain the confidentiality and privacy of client health information obtained while providing care. They need to use their knowledge, skill, and judgment when using social media in nursing practice and in their private lives. These responsibilities apply to nurses who are using social networking sites to discuss workplace issues, just as they do for nurses who discuss their issues in person while outside of the practice setting. Nurses are responsible for their actions and the consequences of those actions. They are also accountable for conducting themselves in ways that promote respect for the profession. Ella is not sure whether to accept Karen as a friend on Facebook. To assist her in making a decision, she reads a few of the college's practice standards, including confidentiality and privacy, personal health information, therapeutic nurse-client relationship, revised 2006, and professional standards, revised 2002. After reviewing the practice standards, Ella decides to decline the invitation. She explains to Karen that they have a nurse-client therapeutic relationship, which is private and professional, not a social and personal relationship. If Ella's workplace uses social media to stay connected with previous clients for a defined purpose, then she could offer that as an alternative to Karen. However, the focus of the relationship still remains professional at all times. Nurses need to continually reflect on how the therapeutic relationship is developing with the client. These relationships may require some adjustments as the relationship develops and changes. Being open and honest with a client helps maintain a therapeutic relationship. The following is a scenario about regular reflection about and clarification of the therapeutic relationship. Christy, a nurse, is providing care for Jim, a client, and his family. They have developed a trusting relationship in a short period of time. Jim's family really likes Christy and how she cares for him. Christy is invited to come and use the family pool anytime she wants and has been invited to Jim's birthday party with his family and friends. The following are some questions you can ask yourself about the scenario. Would Christy be spending more time with Jim and his family than other clients? Is she creating a situation where Jim and his family only want to speak or work with her? Christy reflects on the invitations. She reviews the college's therapeutic nurse-client relationship practice standard, including the list of warning signs that indicate that a nurse may be crossing the boundaries of the nurse-client relationship, and sees that she needs to talk to Jim and his family and clarify what her role as a nurse is, and re-establish the professional boundaries. Christy asks Jim and his family to describe their expectations of her, and then uses this opportunity to reinforce her role as a nurse. She also explains to them that by accepting the invitations, the relationship would become more personal and social, rather than professional and therapeutic. Coexisting relationships occur when a nurse has a relationship with a client prior to providing nursing care, for example, with a family member, friend, or acquaintance. In these relationships, it is often difficult to separate the professional from the personal. If possible, you should avoid providing nursing care to a family member or close friend. When this isn't possible, it is important for you to understand and be aware of the potential effect the dual relationship has on nursing care. You need to clarify the boundary for the client, be aware of the boundary between your professional and personal roles, meet personal needs outside of the relationship, and develop and follow a plan of care. Carefully reflect on whether you can maintain professionalism and objectivity in caring for the client, and whether your relationship interferes with meeting the client's needs. Here is a scenario about coexisting relationships. Joe, an NP, lives and works in a rural practice setting. His neighbor Martha has a condition that requires ongoing monitoring. Before Joe sees Martha as a client, he discusses the care and the issues with his colleagues to determine if there would be another NP who would be more appropriate. In this case, because the community is small, the other NP would face the same issues. Joe reviews the college's therapeutic nurse-client relationship practice standard, and after consulting with his colleagues, some of the questions he asks himself include: Can I remain objective when dealing with this client? How can I keep our social, personal relationship separate from the nurse-client relationship? Are there any ethical conflicts? Joe reflects on how he will present himself and his role to Martha. First, he will ask her how she feels about him providing her health care. He also plans to have a discussion with his role and her role in the therapeutic relationship, and how health information will be shared with the healthcare team. Together, they will develop a plan of care to meet Martha's healthcare needs. Joe will be very clear with Martha that he will not discuss her health when they are outside the practice setting. He will explain that their personal relationship as neighbors will be maintained, but when he is her NP, it will be a therapeutic relationship. In this scenario, Joe has established some strategies to ensure he maintains the boundary in the therapeutic relationship with the client with whom he has an ongoing personal relationship. Maintaining boundaries in a therapeutic relationship can be challenging. The perception of what breaches a boundary may differ among nurses and perhaps even practice settings. You should develop strategies to help you reflect, assess, and change relationships as necessary, especially if you feel a boundary is going to be crossed. The college has a number of documents along with the Therapeutic Nurse-Client Relationship Practice Standard to help you develop and maintain a therapeutic nurse-client relationship. These include professional standards, ethics, confidentiality and privacy, personal health information, documentation, and conflict prevention and management. Entry to practice competencies for RNs, RPNs, and NPs also address the role of the nurse in the nurse-client relationship. All the resources can be found on the college's website. Other strategies that can guide you in maintaining therapeutic relationships include being a reflective practitioner, having formal and informal discussions with colleagues while respecting the confidentiality and privacy of the client, having regular team meetings, using ethical frameworks, and developing your own tools, such as a list of questions to ask yourself after seeing a client. A therapeutic relationship needs to be constantly maintained and adjusted. As a reflective practitioner, you need to be aware of the changes in a relationship and deal with the situation in an appropriate and timely manner. To continue learning about the therapeutic relationship, review the college's Therapeutic Nurse-Client Relationship Practice Standard and watch the supporting learning module. These resources are available on the college's website. Do you have a comment about this webcast? Use the Evaluate this webcast link below to give us your feedback.